Hello and welcome. Today we're diving deep into a rare, yet fascinating, condition affecting the urinary system, bladder hemangioma. We'll explore what it is, what causes it, how it's diagnosed, and what treatment options are available. Join us as we unravel the complexities of this vascular anomaly. The precise cause of bladder hemangioma is often elusive, making it difficult to pinpoint a single etiology. While most are considered congenital, meaning they're present at birth, the exact mechanisms behind their development remain largely unknown. Some theories suggest they arise from errors during the embryonic development of blood vessels within the bladder wall. Others speculate a possible link to genetic factors, although definitive evidence is still lacking. Further research is needed to fully understand the underlying causes of this rare condition. Now, let's understand the pathophysiology. A hemangioma, in essence, is a benign tumor composed of an abnormal collection of blood vessels. In the bladder, these vessels proliferate within the bladder wall, creating a mass. This mass can then disrupt the normal function of the bladder. As the hemangioma grows, it can cause bleeding, as the vessels are often fragile and prone to rupture. This bleeding is the most common symptom. The location and size of the hemangioma will also influence its impact on bladder function. Larger hemangiomas are more likely to obstruct urine flow or cause significant irritation. Bladder hemangiomas are quite rare, representing a small fraction of all bladder tumors. Due to their rarity, accurate epidemiological data is limited. They can occur at any age but are more commonly diagnosed in children and young adults. There doesn't appear to be a strong predilection for one sex over the other. The rarity of bladder hemangiomas makes it difficult to conduct large-scale studies, further contributing to the limited epidemiological information available. The symptoms of a bladder hemangioma can vary depending on its size, location, and the extent of bleeding. The most common symptom is hematuria, or blood in the urine. This can range from microscopic hematuria, only detectable under a microscope, to gross hematuria, where the urine is visibly red. Other potential symptoms include frequent urination, urgency, pelvic pain, and difficulty urinating. In some cases, particularly with small hemangiomas, there may be no noticeable symptoms at all. Diagnosing a bladder hemangioma requires a thorough evaluation and often involves multiple diagnostic tools. Initial assessment typically includes a urine analysis to confirm the presence of blood. Cystoscopy, a procedure where a thin, flexible tube with a camera is inserted into the bladder, allows direct visualization of the bladder lining and any abnormal growths. Imaging studies, such as CT scans or MRIs, are crucial to determine the size and location of the hemangioma and to rule out other potential causes of bleeding. A biopsy, where a small tissue sample is taken for microscopic examination, can confirm the diagnosis and differentiate the hemangioma from other types of bladder tumors. While there aren't rigidly defined classifications for bladder hemangiomas, they can be broadly categorized based on their size, location within the bladder, and the predominant type of blood vessel involved. For example, some may be capillary hemangiomas, composed of small capillaries, while others may be cavernous hemangiomas, characterized by larger, dilated blood-filled spaces. However, treatment decisions are generally based on the patient's symptoms and the specific characteristics of the hemangioma, rather than a formal classification system. Treatment for bladder hemangioma depends on several factors, including the size and location of the lesion, the severity of symptoms, and the patient's overall health. Small, asymptomatic hemangiomas may be monitored without active intervention. For symptomatic lesions, several treatment options exist. Transurethral resection of bladder tumor, or TURBT, involves surgically removing the hemangioma through a cystoscope. Laser therapy can be used to coagulate and destroy the abnormal blood vessels. In rare cases of large or complex hemangiomas, partial cystectomy. The surgical removal of a portion of the bladder may be necessary. Medications, such as sclerosing agents, can sometimes be injected directly into the hemangioma to shrink it. The choice of treatment is highly individualized and should be discussed thoroughly with a urologist. Currently, there are no specific preventive measures for bladder hemangiomas, primarily due to the unknown etiology. Since most are thought to be congenital, preventing their development is not yet possible. However, maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding smoking can contribute to overall bladder health and may potentially reduce the risk of other bladder conditions. Regular check-ups and prompt evaluation of any urinary symptoms are important for early detection and management. The prognosis for bladder hemangiomas is generally favorable, especially with early diagnosis and appropriate treatment. The majority of patients experience significant symptom relief and long-term control of the condition. However, recurrence is possible, so ongoing monitoring is crucial. Recent research is focused on improving diagnostic techniques, exploring less invasive treatment options, and gaining a better understanding of the underlying genetic and molecular mechanisms involved in the development of bladder hemangiomas. The hope is that future research will lead to more targeted and effective therapies for this rare and challenging condition.